Welcome to RN Dream. Please don't forget to subscribe, like, and share this video. Remember, whatever you ask in prayer, you will receive it if you have faith. That's in Matthew 21:22.
So we're going to discuss about the congenital heart defects. Congenital heart defects has two types, the cyanotic and acyanotic. Cyanotic is the disorder from the right to left blood flow of the heart, while acyanotic is from left to right blood flow of the heart. So now we will going to discuss from the most dangerous part, which is the cyanotic. Okay, so this is the normal blood flow of the heart. Okay, so from the inferior and superior vena cava, so our blood from the lower and upper extremities, it will go to the right atrium, then it will open the tricuspid valve, it will go to the right ventricle and to the pulmonic valve, and it will go to the pulmonary artery, and it will distribute to the lungs to be oxygenated. So from that blood, it is deoxygenated. So from the lungs, nagiging oxygenated blood na siya. Okay? So it will go through the pulmonary vein and papasok siya sa pulmonary artery, and it will open the mitral valve. It will go to the left ventricle, it will open to the aortic valve, goes to the aorta, and of course, it will distribute through the systemic. So it will be here, from the systemic, ito na yung magiging cardiac output ng isang pasyente. So isang bata. Okay? So if there will be low cardiac output, nagkakaroon ng low blood pressure. So that one we're going to discuss later on. So now we will start with the right to left disorders of the congenital heart defects. All the right to left defects start with letter T. So let's start with the first defect, which is the tetralogy of Fallot. Tetra means there are 4 defects na nangyayari dito. So, for us to remember, let's remember the word PROV. P-R-O-V. P stands for pulmonary stenosis. Stenosis means it is a small or narrow opening. So, dun sa may pulmonic valve, yan, as you can see, in the pulmonic valve, usually, medyo malaki siya or sakto lang yung daluyan. So, ang nangyayari dun sa may pulmonic stenosis, nagiging narrow yung pulmonic valve, which causes the pulling of blood into the right ventricle. Because of the pulling of blood into the right ventricle, doon na nangyayari yung second defect ng tetralogy of Fallot, which is the right ventricular hypertrophy. So here in the right ventricular hypertrophy, because of the pulling of blood from the right ventricle, kasi nga, di ba, maliit lang yung daluyan papunta dun sa may aorta, sa may pulmonic valve natin. So, nagkakaroon siya ng thickening of the muscles dun sa may right ventricles natin. Kaya kumakapal yun. So, pwedeng mag-backflow yung dugo dun sa may right atrium. So, next is the overriding of the aorta. So, here's the overriding of aorta. Makikita nyo dyan sa picture. Aortic valve is usually misplaced. So, the fourth defect is the ventricular septal defect. Septal means it is an opening. So, dun sa may ventricles, nagkakaroon ng opening between the left and right ventricles. And because of this opening, nagkakaroon ng mixing of blood from the oxygenated and deoxygenated blood. So we'll proceed with the signs and symptoms of tetralogy of Fallot. So this is the most common Nclex question. The most common sign and symptoms that being asked in Nclex is the tet spell. Tet spell is a bluish discoloration of the infant, or means the infant has cyanosis. So there will be a clubbing also of fingertips dahil sa cyanosis. Third, we should monitor for the hemoglobin level of the patient because of polycythemia. If the patient develop polycythemia or hemoglobin greater than 22 milligrams per deciliter, they are at risk for blood clot. So we must report if the patient develop greater than 22 of hemoglobin. So as a safe nurse, how we can able to manage that spell? If the patient is an infant, we should keep them in knee chest position, or if the patient is an older adult, we should keep them in squatting position. And for preventing that spell, we should provide a quiet environment for the patient. And to avoid further crying, of course, if the infant will cry, nagiging decrease yung oxygen. So we will give pacifier. And we will provide a small frequent feeding. Dahil during feeding, pwedeng nahihirapan silang huminga. So, small frequent feeding. So, sometimes in the SETA or prioritization, ang kailangan nating tandaan, first, dapat pina-prioritize natin yung knee chest position. Second is oxygenation of 100%. Third, giving morphine to the patient. Fourth is for IV fluid. And lastly, we will document. And as a nurse, we should remember that we should be alert for the 5 heart failure signs that we should report to the healthcare provider immediately. Okay, these are the 5 signs of heart failure that should be reported immediately. First, we should report if the patient develop weight gain. Second, if the patient develop eye puffiness, pale cool extremities, reduce in the wet diaper, and if there is a decrease in feeding or poor feeding. In the Nclex question, once the patient had echo, makikita natin doon sa may echo that patient has cooler and salot or the boots appearance. Boot shape appearance, okay? Okay, for our management for the tetralogy of Fallot, you should give the patient prostaglandin to keep the dactus arteriosus open from the aorta to the pulmonary artery, and the Blalock Taussig shunt to connect the subclavian artery, and the Brock procedure for the it is the corrective procedure that is being asked in the Nclex question. So it is the incision of the right ventricular chamber and cutting off the stenosed pulmonary valve. So our next heart defects is the transposition of great vessels. So here there are reversal of the two main arteries leaving the heart. We have the pulmonary artery and the aorta. As you can see in this picture, transposition of the great vessels. Yan. Nagkakaroon ng opening. So the management of this is surgery. Then the third one is the tricuspid atresia. So tri means there are three defects here. Closure of the tricuspid valve. So as we can see, there is a closure of the tricuspid valve. We have the ventricular septal defect and the atrium septal defect. Next one is the truncus arteriosus. This is the last defect in the right to left. So as you can see here, there is opening. So there will be a mixing of blood of the oxygenated and oxygenated blood. So now we're going to proceed with the acyanotic type, which is from left to right. So we will start with the first defect, which is the atrial septal defect. So when we say the word septal or septum, it is the opening. Opening means opening. Okay? Huwag natin kakalimutan yun. So atrial means from the atrium, there is an opening. Here, as you can see here, there is an opening between the two atria, from the left and right atria. Second one is the ventricular septal defect. So kanina, dun sa may taas, between the two atrium, and now between the two ventriculars naman. So for example, this is our this is our heart. So this is from the left and right. So this is the hole between the left and right ventricles. Okay, from the oxygenated and the oxygenated blood, nagkakaroon ng mixing. So the signs and symptoms for this patient, nagkaroon ng grunting during feeding, and the systolic heart, there is a systolic heart murmur. Saan? It was located on the 4th to 5th left intercostal space, okay? And in the atrial septal defect, kapag nakakarinig ng murmur, means it is a normal or expected with that defect. So third one is the patent dactus arteriosus. So patent dactus arteriosus, so there is an opening that connects the aorta and the pulmonary artery. Yan, di ba yung aorta going to the pulmonary artery? From the lungs na siya. So, yung signs and symptoms na maririnig natin dito, remember, the word duct is a machinery-like murmur. So, maingay siya. And the management for this is, you should give indomethacin IV as a prostaglandin inhibitor to our patient. So, sa patent dactus arteriosus, usually intrautero, it is normal kasi open talaga siya due to the increase in the prostaglandin among the fetus, and it must close within 3 weeks kapag lumabas na yung bata. So, because of the high prostaglandin, nagkakaroon ng patent dactus arteriosus. So, we are giving this prostaglandin inhibitor, which is the indomethacin. So, next is the atrioventricular septal defect, or tinatawag din itong endocardial cushion defect. And it is most common in Down syndrome. So remember that AVD is most common in Down syndrome. So here, both meron yung atrial septal defect and yung ventricular septal defect. So, dalawa yung butas niya dun sa may atrium and dun sa may ventricles. So, ang nagiging symptoms dito is murmur, which is also expected tsaka normal. And next one is the ventricular and the pulmonic stenosis. So, here, magdidraw tayo ng heart. Okay, kunyari ito yung tricuspid valve. And this is the pulmonic valve going to the pulmonary artery. So, yan, nagkakaroon ng stenosis or yung narrow yung daluyan niya. So, there will be a pooling of blood again to the right ventricles, which will cause also for the symptoms of heart murmur and split of the S2 sounds. So, the management for this para dun sa narrow na valve na yan, ginagawa ng balloon valvuloplasty. So, the patient undergo with the balloon valvuloplasty procedure doon sa may narrow valve. So, the next one is the aortic stenosis. So, for example, this is the heart, and this is the aortic valve. Oh, sorry, this is not the aortic valve. This is the aorta, and this is the aortic valve. So, there will be an stenosis or narrowing in that aortic valve. And remember that, diba, sa aorta, papunta siya sa may systemic. So, if there is a decrease in the oxygenated blood, nagkakaroon ng decrease in cardiac output and it will lead to activity intolerance. So, and if there is an stenosis, nagkakaroon ng pooling of blood which lead to left ventricular hypertrophy. So, kumakapal yung sa may muscle niya. And because of the pooling of blood, it will go to the lungs, to the left atrium going to the lungs. The patient may develop pulmonary congestion. So for the management, same with the pulmonic stenosis, ginagawa ng balloon angioplasty or valvuloplasty to open yung stenosis. So the last one is the correctation of aorta or correctation aorta. So here, as you can see, in the normal heart, same lang yung size ng aorta. But in the correctation of aorta, there is a narrowing of the aorta. So here, normal yung cardiac output niya. But in the upper and lower extremities, they have different symptoms. So in the upper body, there is an increase in BP. And lower body, decrease in BP. And dahil increase yung BP niya, usually it is strong bounding pulse, diba? Kapag lower naman yung BP, weak and ready pulse. So, yun yung mga dapat nating tandaan. So, as an additional management for a patient with congenital heart defects, ito lang yung most common asked questions sa Nclex, like your cardiac catheterization. I-discuss natin dito yung before and after cardiac catheterization. So, before the procedure, you must ask the mother if the patient has any allergy to iodine. And you should keep the patient NPO for 4 to 6 hours for children. And if it is infant, less than 6 hours can be. And after the procedure, we should assess the pulse and the distal insertion site of the catheter. It is normal kung weak yung pulse, and report if it is cold, cool, pale extremity. And we should advise the mother to keep the infant on straight leg for 4 to 8 hours post-operatively, and we should assess the incision site for any bleeding. And encourage the mother not to pass the infant after operation and to remove the dressing after 1 day post-operatively. So second one is chest tube monitoring. So here's the chest tube monitoring. I will not elaborate further, but we will be focusing on what to report during chest tube. Okay, so we should report in 1 hour if the output is over or more than 5 to 10 ml per kilogram, and if in 3 hours, more than 3 ml per kilogram per hour. So, bakit kailangan natin siyang i-report? Because it may indicate severe bleeding and cardiac tamponade. Thank you for watching. Remember, it's not going to be easy, but it's going to be worth it. So keep going, my friend. Thank you. Remember, it's not going to be easy, but it's going to be worth it. So keep going, my friend. Thank you for watching.